My name is Rachel. I'm a physical therapist at Balance Valley Rehab, and I have a specialty in pelvic floor therapy or women's health therapy. I get asked a lot what that means and what it entails, so I hope this video will help you better understand what I do and how it can potentially help you. First off, what is the pelvic floor? It is a group of muscles that travels from our front pelvic bone, our pubic bone, all the way to the back to the coccyx or the tailbone. These muscles are very important. They have a number of functions. The three main ones are they provide support for our pelvis, and they support our organs, our bladder, our rectum, and our uterus. And the last one is it has a role in our breathing pattern. So a lot of dysfunction can come when these muscles don't work optimally or work the way we want them to work. Things that I treat, the most common is involuntary loss of bladder control. This can happen under pressure, so if you're coughing or sneezing or jumping or lifting and you have a leak or an involuntary loss of bladder control, that is a big issue for a lot of women. It can also be urge related, where you have an urge to go to the restroom and you're unable to delay the urge to go, and you're finding yourself having to go to the restroom frequently throughout the day, even if you already emptied your bladder not that long ago. The other conditions I treat that are a little less common are more pain conditions. This can include pelvic pain or low back pain that's being driven by the pelvis. It can include pain with intercourse, inserting a tampon, or even pain with the OB exam. Endometriosis is another pain condition that can be helped by pelvic floor therapy, and tailbone pain is another big reason to seek out pelvic floor therapy. The other less commonly known reasons somebody would seek out pelvic floor therapy would be if they have an overactive bladder syndrome, where your bladder muscle is not acting how it should, and that's very much connected with the pelvic floor. Or if you're dealing with constipation or reoccurring urinary tract infections. All those conditions I can help with in some way with the pelvic floor therapy. It's very important for me to tell women that these conditions are so common. They're so common that they almost seem normal, but common does not equal normal. And if you're struggling with any of those, if you're unable to hold your bladder when you cough or sneeze, or if you're going to the restroom every 90 minutes, or if you're having pain with an OB exam, those things are treatable symptoms. They're a sign of suboptimal pelvic floor functioning, and there's therapy that can help you with that. So if you are interested in learning more about that, be sure to reach out to our office and be scheduled for a pelvic floor evaluation. That evaluation will be a sit down with me and you for 50 minutes, and we'll go over your history and your complaints and what your goals are. From there, we'll do a general postural assessment, and I'll look at some hip mobility, some strength, your breathing pattern, a bunch of things that could be impacting the pelvic floor. There will be a component with consent, if you're comfortable with it, where we'll do an internal exam, and that will involve being draped on the table, and I'll be, with a gloved hand, using my digit to internally assess the pelvic floor muscle. We're looking for trigger points, increased tone, endurance, quality of contraction, muscle activation or coordination. There's a lot that I can tell just by palpating that muscle. If you are seeing me for low back pain or neck pain, it's no different than me getting my hands on your neck and feeling those muscles and feeling where they're tender and what's going on when you're turning your head or lifting up something. If that's uncomfortable though, because some women don't enjoy the thought of having an internal exam, there's still a lot that we can do from an external perspective with assessing your posture and mobility and breathing pattern and hearing what type of habits you have during the day. So I hope this helps clarify what pelvic floor therapy is and how I could help you. And I would really love to see anybody, whether it's for education or a full assessment, to help you achieve your potential and not have these pelvic floor symptoms be a worry.